the argument for ending fluoridation is much stronger now than it would have been in, say, 1955 or 1960.
New tonight at 5:45, the divide over fluoride. The Trump administration is talking about removing the cavity-fighting ingredient from your water because of health concerns and ineffectiveness.
Well, since 2014, dozens of communities all across the U.S. have really voted to remove fluoride or reject it from their local water supply. Just last week, Lebanon, Oregon became the latest to do so. Tonight, 10 TV reporter Kevin Landers takes a closer look at this debate and why some say removing fluoride is a risk to children.
Fluoridated water has been touted as a simple way to reduce cavities in children and adults since the late 1940s. Dentists like Kyle Brogan are now fighting for fluoride's future.
So is it your belief that if we were to remove fluoride from water, that the level of cavities will increase among children?
I do believe that.
The Trump administration is backing the idea of removing fluoridation after Robert F. Kennedy promoted the idea on X, formerly known as Twitter. Kennedy claimed it can lead to a host of health problems. Earlier this year, a federal study determined with moderate confidence that there is a link between higher levels of fluoride exposure and lower IQ in kids. Frank Zelko is an environmental historian and one-time critic of the anti-fluoride movement. Now he says it's time for fluoride to go.
We should definitely consider doing that based on things like the fact that most countries in the world do not fluoridate their water. And comparable countries to the US, such as France and Germany, have never fluoridated their water, and yet their dental health has improved at the same rate as the United States.
170 communities across the country have banned fluoride in water. Zelko says a 25% decline in cavities due to fluoridated water isn't enough for him to convince it's worth keeping.
That the topical application directly to the teeth is far more effective than drinking it in the water.
Is it really more effective to use toothpaste, which is not ingested, versus fluoride, which is?
So you can think of the effect of water fluoridation and fluoridated toothpaste as kind of acting synergistically. And so that 25% reduction with the use of fluoridated water, so you can think you're drinking water during the day, so that's kind of low levels of fluoride throughout the day, kind of soaking your teeth and protecting your teeth. While at nighttime, at bedtime, you're getting that higher dose with the toothpaste.
The anti-fluoridation movement scored a victory in September when a Northern California judge ruled against the U.S. EPA when it comes to fluoridation. The judge ruled, quote, plaintiffs have proven by a preponderance of the evidence that water fluoridation at the level of 0.7 milligrams per liter presents an unreasonable risk of injury to health or the environment. Should a federal fluoride ban go into effect, water departments across the state and the nation could remove it.
And if you joined us at 5 o'clock, we told you that within the hour, Trump has asked Robert F. Kennedy to be the next Secretary of the Department of Health and Human Services. Now, according to the Ohio EPA, federal law does not mandate that public water systems use fluoride in water, but the Ohio statute does. The EPA tells 10 TV it's too early to tell how this could impact us here in Ohio.
Mm-hmm. Now, Kevin, is there a timeline on when the ban could take effect?
There isn't, and it really comes down to this is just an idea right now. So we don't know exactly how this is going to be written, if this could be implemented immediately or whether this could be done over time. The other thing we don't know is what the cost is going to be to all these public water systems to remove fluoridation.